listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, many of us are feeling the weight of inflation, including your clients. Discover how to fact find and help clients find coverage in different financial circumstances. What today's financial environment means for Medicare beneficiaries and agents. Written by Roxanne Anderson. Can Medicare beneficiaries afford coverage? Perhaps a better question is, can they afford to be without it? U.S. inflation hit a 40-year high of 9.1% in June 2022. While it decreased to 3.4% in December 2023, prices have not returned to their pre-pandemic levels. Given today's tough financial environment, it's imperative for agents to make educated health insurance coverage recommendations. A good starting point is considering inflation and recent statistics on the income and assets of Medicare beneficiaries. However, you should always complete personalized fact-finding for each client to determine their exact budget, how much coverage they need and can afford, and what makes sense for their unique situation. Money might be a taboo topic, but it's an important conversation to have with clients. We need money to get the things we want and need, including healthcare and health insurance to afford healthcare. But what happens when Americans are spending a higher share of their income on food, the highest in 30 years, in addition to utilities and other commodities? Between January 2020 and December 2023, food prices increased 25%, energy prices increased 26%, and overall prices increased 19%. While inflation does not directly affect Medicare premiums do grow with rising healthcare costs, and the healthcare industry is not exempt from inflation. In fact, medical costs typically rise faster than inflation. The cost of medical care, hospitals, and related services, prescription drugs, and non-prescription drugs have each risen between 0.7 to 4.2% since December 2019. Studies have found that those with low incomes have been most severely affected by inflation. A recently published report from KFF shows us that Medicare beneficiaries may fall into this group. KFF, an independent source for health policy research, analyzed the income and assets of Medicare beneficiaries in 2023. Their findings can give agents an idea of the financial situations of Medicare eligibles at large. First, let's look at how much do Medicare beneficiaries earn in a year. KFF reported that half of all Medicare beneficiaries, 32.6 million people, had incomes below $36,000 in 2023. Only 5% of beneficiaries earned more than $138,500 annually. Incomes varied by race, ethnicity, age, and sex. Beneficiaries who did not graduate high school, were Hispanic, or were single held the lowest median incomes. Beneficiaries who were college graduates, married, or white held the highest median incomes. And to put some dollar amounts on that range of income, the low end came in at $17,750, with the high end capping at $62,150. Now that we've gone over earnings, let's move to how much do Medicare beneficiaries have saved? KFF reported that half of all Medicare beneficiaries had savings below $103,800 per person in 2023.
10% of beneficiaries had no savings or were in debt. 5% of beneficiaries had savings exceeding $1.6 million per person. Savings also varied by race, ethnicity, age, and sex. Beneficiaries who did not graduate high school, were Hispanic, or were Black held the lowest median savings. Beneficiaries who were college graduates, married, or white held the highest median savings. If you want a full report of Medicare beneficiary assets from KFF, we'll have that linked in the episode notes for you. According to KFF, quote, most Medicare beneficiaries live on relatively low incomes and have modest financial resources to draw upon in retirement if they need to cover costly medical care or long-term services and supports, with notable disparities by age, race and ethnicity, and gender, end quote. But as a health insurance agent, you know it typically isn't an if, it's a when. Some services provide healthcare that people shouldn't or can't live without. As we age, it's vital to maintain affordable access to healthcare, even and especially during tough financial times. The National Library of Medicine reports that older adults use far more healthcare services than younger adults, and that most have at least one chronic condition requiring care. Additionally, longtermcare.gov states that someone turning age 65 has about a 70% chance of needing some type of long-term care service and support in their future years. Medicare helps make healthcare affordable for many Americans, but it does not cover all medical care, including custodial long-term care services and supports. Remember, KFF found half of all Medicare beneficiaries had incomes below $36,000 in 2023. Half of those beneficiaries earned less than $21,000. In 2023, the federal poverty level income was $14,580 for individuals. The living wage, what one needs to cover basic family needs like food, housing, transportation, and utilities, without receiving outside assistance, was about $36,000 for one working American adult with no children, according to the Massachusetts Institute of Technology. Keep in mind, a general rule of thumb states that one should have 80% of their annual income for retirement. Using MIT's living wage calculator, with the living wage as an estimate, retirees may have needed around $28,800 in 2023 just to cover basic needs. This was $7,800 more than the income of at least 16.3 million Medicare beneficiaries. In a separate study, KFF recently found that 36% of Medicare beneficiaries delayed or went without care in a year because of the cost. Genworth estimates that an in-home health aide cost $75,504, and a semi-private nursing home facility room cost $104,025 in 2023. Remember, KFF found that half of all Medicare beneficiaries had savings below $103,800 in 2023, and half of those beneficiaries had less than $16,950 saved. At least 32.6 million Medicare beneficiaries couldn't afford a semi-private nursing home room for the year using their savings. These figures alone show the need for beneficiaries to make cost-conscious decisions, but they don't have to do it alone. That's where agents like you come in. As a health insurance agent, it's your duty to help your clients find the coverage that fits their health and financial situation. You can use these statistics to better prepare for conversations. However, It's vital you complete personalized fact-finding to recommend the best possible health insurance plans. Which leads us to this question. How do we take all of these stats and use this knowledge to your benefit? Being able to read the room, adapting to your client's words, body language, expressions, tone, that is so important for connecting with them. Think of statistics as a way to read the figurative room of your general sales audience. If you sell Medicare plans, recent stats indicate your clients could very well be experiencing financial stress and delaying care. You want a sale, but even more, you want loyalty. Client retention can boost your insurance sales and commissions. Pressuring someone to spend more on ancillary plans may not go over well, but if you don't ask, you won't sell. Could you save clients money on prescriptions first? Making the effort to save your clients some money rather than piling on premium expenses will go a long way in creating trust and appreciation. Remember to avoid overgeneralizing too. It may be tempting to think that due to today's tough financial environment and the fixed or limited incomes or savings of many Medicare beneficiaries, clients aren't interested in more benefit-rich, higher-cost coverage or supplemental plans. Be careful not to make assumptions. Everybody values things differently. You'll need to uncover the facts for each client before you recommend plans. Fact-finding is the process of asking the right questions and listening to uncover clients' needs. It helps agents determine what existing coverage clients have, might need, and can afford. A simple one-page fact finder can help guide your conversations, but we have some additional tips to help you find more success. Establish a client's exact budget. To pinpoint a client's budget, agents can request information on their annual income and investments upfront. Sources of income may include jobs, Social Security, retirement plans, IRAs, annuities, mutual funds, savings, etc. Clients should have an idea of their typical monthly and yearly expenses. Ask how much they can afford to spend on their health insurance premiums and out-of-pocket costs for healthcare services. Determine how much coverage is necessary. To gauge that, agents should complete a needs assessment. Consider all medications, health conditions, family medical history, and preferred healthcare providers. These factors may affect enrollment options and costs. Additionally, check if the client has any existing insurance policies and what exactly they cover. Fostering trust with clients is vital. To have a smooth fact-finding experience, establish trust with your insurance clients beforehand. Finances can be a sensitive topic. Clients with limited incomes and assets may feel self-conscious discussing how much they can afford. Those with higher incomes and assets may feel uncomfortable sharing just how far their funds go. Additionally, people just want to stay safe from insurance fraud and avoid health insurance scams. They must believe that you are truly working in their best interest and not just in it for your own benefit. Let's talk making coverage recommendations. With prices up, a penny saved might just be a penny earned, but agents shouldn't recommend the most affordable options. After fact-finding, you'll have all the information you need to accurately pull quotes and make plan recommendations that meet your client's budgets and needs. Missing one of your client's prescriptions can be a costly mistake if it isn't on their new plan's formulary. But you'll have the list of all their medications to use while searching for coverage. You may see a more affordable way to give a client access to the healthcare providers they see. Maybe they're in-network in a $0 premium Medicare Advantage plan. If they're low income, consider if they qualify for a dual eligible special needs plan, the Extra Help Program, or a state pharmaceutical assistance program. As their agent, you can make them aware of these options and help them potentially save money on premiums, coinsurance, and more. Some clients will have a large income or amount in savings, but they may not want that policy with all the bells and whistles. Clients who have smaller incomes or savings may not want to risk the exposure to out-of-pocket costs. What you recommend should always depend on the client, their specific budget and needs, and how much they value the protection that health insurance provides. Stay penny-wise and aware of your clients' situations. With the cost of goods continuing to rise, Americans have been feeling the pinch of spending more. Many individuals on Medicare live on low incomes with little to no savings, making it crucial they elect the best possible coverage for their unique health and financial situation. When making recommendations, agents should keep inflation and recent statistics in mind, but ultimately, thorough fact-finding will ensure your clients have coverage worth the costs. Here at Ritter Insurance Marketing, we partner with over 120 carriers, so you can offer your clients health insurance coverage that meets their needs, and your clients can maintain access to affordable health care. Register for free with our site to explore all of our coverage and contracting options and our innovative sales tools for health insurance agents. You can grab the link to find out more about registering with us in the episode notes. And if you have any questions, don't hesitate to reach out either by email at ritterim.com or by leaving a voicemail at 1-717-562-7211. Thank you so much for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Roxanne Anderson. Script adaptation by Tina Lamoureux. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with our show wherever you like to listen.